Hi, I'm Dr. Larry Malerba, and welcome back to the All Things Homeopathy Materia Medica series. Today I'll be discussing carcinosin, a homeopathic nosode made from a breast carcinoma. Also known as carcinosinum, carcinosin is a deep-acting remedy that has helped countless patients in my practice over the years. Because the profile of this invaluable remedy has become increasingly clear in recent decades, homeopaths are prescribing it with greater frequency and they're achieving excellent results. So let's talk about the materia medica of carcinosin.
All right, so carcinosin is a homeopathic nosode made from a breast carcinoma. It's the main representative remedy of the cancer miasm. Bear in mind that Dr. Hahnemann did not identify a cancer miasm during his lifetime. And although cancer has likely existed from the beginning of time, it appears to be much more prevalent nowadays compared to, say, 100 years ago. I don't want to get bogged down in a discussion of why this is the case, but the allopathic explanation that claims it is due to population growth and longer lifespans is only partially correct. What conventional medicine always fails to comprehend is that its own relentlessly suppressive approach to human illness is an enormous factor that contributes to the rapidly rising rates of many chronic diseases, and cancer is no exception. It's my firm belief that allopathic suppression is the main cause of the increasing prevalence of cancer in both children and adults in modern times. So the cancer miasm is the miasm that has defined our times. That is, until AIDS came along. With the advent of AIDS, we've seen a marked rise in diseases characterized by autoimmunity and immunodeficiency. I'm pretty confident that we can place the blame for this trend at the feet of the biotech industry. And we've recently witnessed a dramatic escalation of this phenomenon with the release of the SARS-CoV-2 virus from a biotech lab, along with the near compulsory administration of COVID vaccines to most of the global population. Now, there's a good bit of disagreement within the homeopathic community about whether the original single breast tumor version of this remedy is adequate. Some theorize that it's not capable of dealing with the cancer miasm as a whole. As a result, it is now possible to purchase several newer versions of carcinosin that are produced from multiple tumors from different anatomical regions of the human body. For example, we now have carcinosin 15T, which is made from a combination of 15 tumors. We also have carcinosin 48T, 58T, and others. All I can say is that I've seen the original carcinosin work wonderfully for my patients over many years of practice. I find no reason to believe that it's inadequate or that it needs to be replaced. Unfortunately, over time, a good bit of allopathic thinking has crept into the homeopathic profession. So I can see why some would think that multiple tumors are better than one. And remember that the homeopathic principle is based upon similarity, not identicality. While isopathy does have a role in treatment, it should not supersede treatment by similars. So bear in mind that the version of carcinosin that I'll be talking about in this video is the original remedy made from a single breast tumor. Okay, so since carcinosin is such a broad and complex remedy, which makes it so easy to confuse with a number of other remedies, I'm going to start by sketching out some of its most important and reliable identifying features. These keynote features include the following: a tendency to put others' needs before one's own needs, a desire for chocolate, especially dark chocolate, a love of thunderstorms, birthmarks, especially cafe au lait coffee stain marks, sleep disorders, and a tendency toward constipation. Now, we often see some combination of these keynote clues in several different carcinosin types. First, there is the overachiever type, who appears confident and is driven to succeed, but who also desires to please others. The next type is the precocious kid with adult-like emotional maturity. Then we have the sensitive, timid type who lacks confidence and may have a history of mistreatment or abuse. And lastly, we have the backward types that have behavior problems, developmental issues, or autistic traits. Please understand that this is not a definitive statement about the various types of carcinosin presentations. This is just my way of categorizing the various cases that I've seen over the years. In fact, quite a number of them could easily be characterized as being a blend of two or more of these different types. Okay, now let's examine these types a little more closely, beginning with the precocious type. Of course, the definition of a precocious child is one who demonstrates the qualities or abilities of an adult at an unusually early age. They tend to be developmentally advanced and strikingly mature. It's hard not to love kids that fit the precocious type. They're mature, thoughtful, kind, considerate, and very self-aware. They're honest, open, sincere, well-mannered, and well-spoken. They're model children, and this makes them very easy and pleasant to talk to and to interview. In fact, their parents will often say that they tend to get along better with adults than with their peers. In this sense, they're like little adults with adult-like emotional maturity. I dare say that some that I've met give the impression of being more mature than their own parents. Of course, the problem for some of these kids is they tend to grow up too fast without really ever getting a chance to be carefree kids. Because of the way that they are, the grown-ups around them, including their parents, tend to treat them as if they are adults, sometimes saddling them with adult-like burdens and responsibilities. An example of this is the academically advanced kid who excels so well that he or she graduates from school at an early age. This can then create further problems when the same child is suddenly surrounded by older kids in a college setting. Now, it's easy to see how the precocious carcinosin type can naturally segue into the next type, which is the overachiever type. And it's easy to spot the overachievers when they're teenagers. They tend to excel, especially in academics. Some are near the top of their class, and they're often involved in multiple sports and extracurricular activities. They usually have a strong sense of duty and responsibility, even from a very young age. If I suspect this to be true, I just ask them directly if they are overachievers. They will often respond quite proudly, saying that yes, they are. Most have high expectations of themselves and are driven to achieve. They have high standards and like to set goals for themselves. Many aim for perfection. Some will admit that they want to be the perfect son, daughter, athlete, or student. The fact that they have a need for order and are well organized, good at planning, and tend to be fastidious and perfectionistic goes a long way toward helping them achieve their goals. Many have a strong need to push themselves to succeed. Now, there's really nothing wrong with any of this. In fact, it's quite admirable in a certain way, and I consider it a privilege to talk to kids like this. However, if taken to an extreme, this need to push oneself not infrequently leads to trouble. Just take one look at the average high school student who wishes to go to an Ivy League school or wants to become a doctor or a lawyer, for example. These are the people who run themselves ragged. They tend to overextend themselves in ways that are just not sustainable. Some push themselves because deep down inside they feel unfulfilled. Some have a need to achieve something that is realistically beyond their capacity. Some feel responsible for just about everything. They have the weight of the world on their shoulders. Unfortunately, this otherwise praiseworthy desire to succeed can easily become dysfunctional and may spill over into workaholism and eventually into burnout. I think this is why carcinosin is one of the main remedies for mononucleosis. They push themselves so hard that they eventually crash and burn. And while they're laying at home in bed trying to recover, what do you think they're most concerned about? Why, they're academics, of course. I've seen them get all stressed out over falling behind at school. And of course, we always consider carcinosin in cases with a prior history of mono. And it's the main remedy for those who've never been well since mono. Broadly speaking, carcinosin is the remedy for overachieving workaholic teenagers who are at risk for burnout. Now, another dysfunctional aspect of the overachiever type can be guilt. Whenever we encounter an overachiever, it's important to inquire as to their motivations. Why is it that they are so ambitious? Why do they work so hard? I've found that for a good number of them, it's a self-imposed internal pressure that they place upon themselves. But for others, it can be a function of guilt, which brings us to the next carcinosin type, the sensitive type. Now, the sensitive carcinosin type is the type who puts everyone else's needs before their own. They're so sensitive, compassionate, and sympathetic to the needs of others that they can be easily taken advantage of. These are the parent-pleasing, people-pleasing, conflict-avoidant individuals who lack adequate boundaries. Their sensitivity makes it nearly impossible for them to say no to the demands, requests, or even implied needs of others. Instead, they acquiesce, like self-sacrificing martyrs, more concerned about offending the sensitivities of others than the burdens that they wind up heaping upon themselves. So we can see that when an overachiever type also has a tendency to feel guilty just for saying no, it can lead to a lot of trouble. They typically let others violate their space and are too meek or timid to resist when others ignore their boundaries. Not surprisingly, they forgive others for their transgressions faster than they forgive themselves. They often worry more about the needs and concerns of others than their own needs. Now imagine what can happen when a domineering parent, or just your average everyday pushy parent, places a set of expectations on a child or young adult like this. Maybe they want their child to be successful. Maybe they want them to get straight A's. Maybe they want them to go to a certain college. Maybe they want them to become a doctor, a lawyer, or an engineer. And what happens when a son or daughter takes those expectations to heart and in the process overrides their own interests, dreams, and wishes? Such individuals can be so used to trying to make other people happy that when asked, they don't even know what their own dreams or wishes are. Sometimes they never even thought about it. The net effect tends to be a mixture of confusion, anxiety, and a debilitating lack of confidence. They wind up afraid to make mistakes, afraid to let others down, and afraid of being criticized. In short, they don't know who they really are, where they stand, or what they really want. Now, another aspect of the sensitive carcinosin type is that they can be easily wounded, and this makes them easy targets for abuse. Given their sensitivity and empathic nature, it makes sense that they would have strong bonds with the family. However, sometimes they can be too close to the family. They can be enmeshed in the sense that they may have a hard time separating themselves out and becoming truly independent individuals. These same qualities also make them susceptible to parental domination or suppression by strict parents. Carcinosin is a remedy for ailments that arise from psychological abuse, sexual abuse, and the prolonged fright that can come from living with an abusive parent. Sometimes carcinosin types are self-critical and blame themselves, even to the point of self-loathing. Okay, now there's at least one more carcinosin type worth mentioning, and they are the ones with emotional, behavioral, and developmental issues. Broadly speaking, carcinosin can fit a wide range of kids with attention deficit problems, including kids with OCD or obsessive compulsive disorder. Some are obstinate, rebellious, and even destructive. Some exhibit a disposition to masturbation from an early age. In addition, carcinosin can fit kids with developmental issues, including mental retardation. And I have also found that it frequently helps children on the autism spectrum. Now remember, as I said earlier, these carcinosin types are not necessarily separate and distinct categories. They often overlap. I've seen lots of cases that display traits from two or more of these types. It's important, therefore, to keep your mind open and your thinking flexible. Furthermore, these descriptions don't apply just to kids. They can easily fit adults, too. All right, before I talk about carcinosin's fears, I want to talk about their loves, because their loves tend to be more valuable clues when it comes to choosing this remedy. The most important one by far is a love of thunderstorms. Carcinosin is thrilled by and feels better during a thunderstorm. The only remedy that rivals carcinosin on this count is sepia. Carcinosin types also love the thrill and excitement of travel. In addition, many are animal lovers, and they also love nature in general. The carcinosin type's sensitivity also predisposes them to being artistically inclined. Many are lovers of dance, music, and art. Now, on the flip side, two of the more prominent carcinosin fears include fear of cancer and a fear of spiders. There can also be a fear of disease in general, or a fear of death, or anxiety about health. And along with spiders, there may be a general fear of insects. Given carcinosin's drive to succeed, it makes sense that there could be a fear of exams, a fear of failure, or a fear of being unable to accomplish one's goals. Carcinosin also lists under fear of crowds. And lastly, although love of thunderstorms is more indicative of carcinosin, sometimes we see a polar opposite fear of thunderstorms. All right, now let's move on to the generals and modalities. Okay, now, in my experience, the one biggest telltale clue for carcinosin is a desire for dark chocolate. Most references simply say that carcinosin likes chocolate. But when someone admits that they're a chocolate lover, I always ask whether they prefer milk or dark chocolate. Some carcinosin cases do prefer milk chocolate, but if they tell me that they prefer dark, it's an even stronger indicator for carcinosin. Additional carcinosin food preferences can include a desire for spicy foods and a desire for or an aversion to fatty foods, salty foods, eggs, and milk. Temperature-wise, I've not seen a strong pattern one way or the other. Some are warm-blooded and some are chilly. Like Meterinum and Tuberculinum, carcinosin kids can sleep in the genupectoral or knee-chest position. Oftentimes, there's a family history of cancer. There can also be a family history of tuberculosis and or diabetes. I once prescribed carcinosin for a young woman with insulin-dependent type 1 diabetes. She promptly broke out with an itchy rash from head to toe. I would never have expected it to cure her diabetes, but almost overnight, it did dramatically reduce her daily insulin requirement, and she continued to need much less insulin for a very long time. Carcinosin is also indicated when there is a personal history of whooping cough or, as previously noted, mononucleosis. We also think of it for ailments that begin at puberty. In terms of modalities, carcinosin types are intolerant of or aggravated by consolation. They can be worse in the afternoon, anywhere between 1 and 6 p.m., and they're often better in the evening. They tend to feel better after a short nap. Another modality that covers both polar opposites is that carcinosin can be either better or worse at the seashore. Now, even though carcinosin covers a broad range of physical ailments, we tend to prescribe this remedy according to its psychological profile and some of the keynote features that I mentioned at the beginning of this discussion. In other words, most of the physical complaints tend to be less helpful when choosing this remedy. However, one clue that helps a great deal are birthmarks. We think of carcinosin when we see dark moles, and especially when there are coffee-stained birthmarks, otherwise known as cafe au lait spots. Carcinosin is also a remedy for chronic fatigue, especially when it can be traced back to mononucleosis. It fits both never well since mono and never well since whooping cough. It's also a remedy for vaccinosis, where there are frequent colds, fevers, and acute illnesses after vaccination, or asthma after vaccination. We think of carcinosin for recurrent fevers, or fever of unknown origin on the one hand, or a prolonged absence of any fevers on the other. Another useful clue is a tendency toward constipation, especially chronic constipation. Carcinosin types tend to have a lot of sleep problems, especially difficulty in falling asleep. There can be insomnia from anxiety, anticipation, or just an overactive mind. And there may be a tendency to wake early after 4 a.m. It's also one of the main remedies for insomnia that begins at a very early age, even from birth. Additional clues include eye blinking, facial twitching and facial tics, nail biting, skin eruptions that itch when undressing, molluscum contagiosum, and warts on the palms or soles of the feet. All right, now that brings us to remedy relationships. Okay, so as I said, carcinosin can sometimes be tricky to spot, mainly because it has features similar to a lot of other remedies. For example, phosphorus can also be pleasant and very easy to talk to, is kind and empathetic, and likes chocolate, spicy, and salty. Staphylococcus aureus is sensitive, easily suppressed, has warts, and fits ailments from domination and abuse. Thuya also fits warts, lacks confidence, has ailments from abuse, and feelings of guilt and shame. Meterinum is passionate and sympathetic, fits kids with ADHD, is better at the seashore, sleeps in the knee-chest position, and desires fatty and salty foods. Tuberculinum loves travel and adventure, fits kids on the autism spectrum, desires milk and salty foods, sleeps knee-chest, fits fever of unknown origin, and can be better or worse at the seashore. Natura muriaticum is similarly kind, mature, and sensitive, is easily wounded, is averse to consolation, fears spiders and crowds, and likes salty and chocolate. Nux vomica fits ambitious overachievers, fears failure, suffers from constipation, and loves fatty and spicy foods. Ignatia is highly sensitive, sympathetic, easily wounded, likes to please others, and is aggravated by consolation. Sepia loves thunderstorms and chocolate, loves to dance, and is prone to constipation. And lastly, causticum is very sensitive and sympathetic, fits warts, and likes salty foods and eggs. Okie doke, that's my 2 cents on carcinosin. I welcome your likes, shares, comments, and questions. Thanks as always for tuning in, and please don't forget to subscribe to the All Things Homeopathy channel. May the vital force be with you and your loved ones.